All right, so just a little bit of introduction. My name is Caudillo. My pronouns are he, him, and his. I'm the technical assistant coordinator for the Center for Rural Health at the University of Arizona. I am a master's of public health student focusing on applied epidemiology with the University of Arizona as well. So I'm doing my internship here with the Center for Rural Health and got a lot of support. I am on the Overdose to Action grant. One of my main focuses was looking into sober living homes and medication-assisted treatment barriers and resources for collaboration. I did a webinar just last week or 2 weeks ago on this topic, and as well as sent out a survey, just trying to get some information from all over the state of Arizona, trying to see where our barriers at and resources are. So I would like to start off with, defining what sober living homes are. So this is from the Arizona Revised Statutes. Sober living home means any premises, place, or building that provides alcohol-free or drug-free housing and promotes independent living and skills development, may provide activities that are directed primarily toward recovery, provide supervised setting to a group of unrelated individuals, and they do not provide any medical or clinical services or medication administration except for verification of abstinence. So this can just be like drug testing. I also like to define what, medication-assisted treatment is. So along with, it's within the Arizona Revised Statutes as well. Medication-assisted treatment means the use of pharmacological medications that are approved by the U.S. Food and Drug Administration in combination with counseling and behavioral therapies to provide whole patient approach to the treatment of substance use disorders. Both these definitions from the Arizona Revised Statutes can be found on the special licensing of the Arizona Department of Health Division Services. These are coming directly from the policies and procedures in order to obtain a license and what sober living homes need to do within the state of Arizona to comply with that with licensing. One of the rules that I like to emphasize is this rule, which allows the acceptance and retention as a resident of an individual who is receiving and will continue to receive medication-assisted treatment. One of the survey results that I received for the webinar was a lot of sober living homes in the state of Arizona don't accept medication-assisted treatment. And there's either two reasons for that. The first reason is there's not enough education on the administrators of what medication-assisted treatment really is. And the second point is there's stigma around it, and they don't believe that medication-assisted treatment is an abstinence approach. And using medication isn't the whole purpose of being in a sober living home, which I definitely disagree with that. SAMHSA has their goals of MAT, which they're listed right here, which improve the patient survival, increase retention and treatment, decrease illicit opiate use and other criminal activities among individuals with substance use and opiate use disorders, increase the ability of individuals to gain and maintain life skills, and improve birth outcomes among women who are pregnant and have substance use disorder and opiate use disorders. As if you can, from just reading these, you can see that the goals of MAT kind of align with the goals of sober living homes in Arizona on what to provide. There are a lot of barriers, and I think looking into these barriers, it's really important to highlight what resources we can provide for the state of Arizona and other states, hopefully, and also kind of find what are the best practices for what sober living homes can do for individuals to support their journey on medication-assisted treatment. And here are some of the goals that I pulled from the SAMHSA Best Guidelines. I did send out this article, and I can pull it up as well. And these are the 5 bullet points I really want to talk about for best practices. The first one is always have a clear and concise definition on the service provided in sober living homes. This could be the scope and practices of the sober living home, defining what sober living home means to this facility. I know from my experience in working with sober living homes, I was a state licensed surveyor and licensed sober living homes in the state of Arizona. A lot of sober living homes had conflicting definitions on what they provided and what kind of treatment and services they provided. And having these clear definitions assist the individuals who are seeking recovery kind of have the correct mindset of what they're looking into. And this coordinates with the bullet point number 2, which developing written policies and procedures. One of the criteria for continuing a license with the state of Arizona is to have written policy and procedures, and The state of Arizona does have their own outline that sober living homes should follow. And having these policies and procedures kind of also help out the residents and the facilities kind of have a clear, how would I say this, like a clear, I guess, criteria for individuals entering the sober living homes. These policies would help individuals more, excuse me, I just lost my train of thought. These written policies and procedures help the residents be aware of the support that they're able to have, complaint processes they can do if they're treated differently for being on MAT, for reporting medication abuse from other residents taking their medications. And also with these written policy and procedures, it does outline when someone enters with medication-assisted treatment, how does the coordinators of or the administrators for that sober living handle those individuals on MAT? So do they keep the medication in lockers and disperse it when they need to? Is it solely the individual's responsibility to take care of their medication? Number 3 is assessing the current and potential residents' needs and appropriateness of the sober living home. So as I mentioned, a lot of sober living homes don't admit medication-assisted treatment residents into their sober living homes for one or two things. Either there's not enough education on that, or there's a stigma. Regardless of that, medication-assisted treatment should be allowed. And it's not necessarily saying your sober living home should be forced to allow it. It's kind of addressing what kind of level of care does this individual need. So it's kind of doing like an admissions review for, in a comparison, like a patient from a hospital is going to a skilled nursing facility. They kind of they need to review their admission criteria and see if they're a good fit, or if they need higher level of care, or if they need lower level of care. It's kind of the same thing here with individuals coming into sober living homes. The administrators and the house manager should see if they need more level of care, if they need less level of care, or the sober living home is appropriate to meet their needs while on medication-assisted treatment. And then that goes with evaluating program effectiveness and resident success. This is when patients are admitted into sober living homes and seeing how they're doing and how they're getting along with other residents or how much support they have from residents and family members while using medication-assisted treatment. And lastly, and I think this is like the most important one, is always educating and promoting staff, residents, and family friends on medication-assisted treatment for support services and awareness. So educating and promoting is one of the things that I found in my survey that sober living homes around Arizona and administrators or peer support specialists needed as a resource was educate on MAT 101 and sober living home 101, just because there's not enough education or awareness on both the collaborative models. And these are the 3 articles that I had pulled up. First, it's the Arizona Recovery Association. They're known as ASRA in the state of Arizona. They do their third-party independent licensing, and they help out sober living homes in the state of Arizona get licensed with the state of Arizona. And also they do their own inspections and provide resources and support. Their parent is the National Alliance for Recovery Residents. They have, they're the parent to ASRA, and they kind of have other states, like Florida has their own ASRA version, and I know California has the other one as well. And where I got the 5 bullet points were from SAMHSA, Recovery Best Practice Suggested Guidelines. And I can email all 3 of these links. I just have the same constraint, so I do apologize for that. I definitely want to get any questions or concerns.
Questions for Martine?
Hi, Martine. This is Sarah Graham with Oxford House. I got on a little bit late. Can you clarify? Were you saying that it's illegal for sober living homes to not allow people to be on MAT?
Yes. Well, I wouldn't say. I'm not going to say illegal. I'm going to say more. There can be, if a sober living home is. Can you guys still see my screen?
No.
No.
I think what I heard you say was, so if an individual is on medication-assisted treatment, they need to be in the appropriate living setting, but their medication is primary.
Right. So when a sober living home is licensed with the state of Arizona and they're turned, someone on MAT is turned away just because they're on MAT, that's where it gets creates an issue and it can be illegal.
Right.
The state of Arizona receives a complaint from that individual or whoever reported it, and they kind of write notice of deficiency and let them know that they're not allowed to do that, and they recite the rule that I showed you. So again, when I spoken with sober living home administrators, it was mostly, kind of giving them key points. If you're denying someone on MAT, there has to be a particular reason on why you're denying them. And that's why I said that they need higher level of care, or the specific sober living home can't support their needs because they don't have no one else on MAT to support them, or any other organizations for resources.
Okay, thank you.
Of course.
Other questions for Martine? If not, thank you. And also thank you to Kathleen as well